Hello, my name is Monique Mrazek, and I'm a senior health tech industry specialist at the International Finance Corporation, the private sector arm of the World Bank Group. My project is focused on the screening and diagnosis of breast cancer in emerging markets and the challenges around access to technology for this. Why did I choose this topic? Like many of us, I've had firsthand experience with breast cancer, and I appreciate the importance of regular screening and early detection of this disease. My day job is investing in health technology that improves access to quality and affordable healthcare in emerging markets. I was keen to see if we could invest in technology specifically that would benefit breast cancer patients in emerging markets. But first, I needed to document the current state. The starting point was this: 1 in 8 women will develop breast cancer in her lifetime. Early detection can simplify care pathways and improve survival rates. Breast cancer is often diagnosed in later stages in emerging markets. And generally, we know there is a shortage of medical technology and related professionals, and this would likely be no different for breast cancer. So what did we do? The first step was to identify internal stakeholders to support the project. I was fortunate to find a colleague who was interested to work with me on this. After undertaking desk research on the topic, we drafted a structured interview questionnaire, identified relevant stakeholders leveraging institutional relationships, and subsequently undertook 30+ interviews with stakeholders representing a variety of roles, including providers, technology innovators, NGOs, advocacy groups, and other thought leaders. I've included some logos here. For my institution's purpose, the work was largely focused around the private sector. And I want to acknowledge up front that this work is indicative. So I want to share some key findings. For some women in emerging markets, a physical breast exam is currently the only regular screening they have access to. Imaging is only made available when something is felt on the physical exam. However, we did speak to some emerging market providers who have implemented more standard global practices for breast cancer screening, and including imaging. And unsurprisingly, rates of early detection and survival rates start approaching those of more developed economies. A number of interviewees commented on the lack of imaging equipment or lack of appropriately trained personnel from technicians to radiologists. Routine maintenance and calibration of equipment was also found to be lacking. A lack of funding on all levels is an obstacle, from patient coverage to funding to invest in equipment, training, personnel, and care pathways. Tech innovators developing solutions that are especially appropriate to low resource settings struggle to get funded and face other obstacles. Women's health, unfortunately, is severely underfunded by traditional venture capitalists, even in developed markets. One unexpected finding was the limitations around pathology capacity, and in some cases, interviewees noted that misdiagnosis was suspected. What are the next steps? I plan to use this baseline research to help inform investment priorities around breast cancer, and also want to use the research to help identify upstream interventions in care pathways that could lead to downstream investments. Finally, I wanted to share some reflections on my WomenLift Health journey. I am truly grateful to have been selected to be part of this program and to have met and learned from so many amazing women. I want to thank my management for having me take time to be part of this program and to foster my personal growth. The starting point for me was the 360 and gaining an understanding of who I was as a leader. A second big takeaway was that sometimes leading means stepping away from my comfort zone and using leadership approaches that are not always comfortable for me. A third big takeaway that I'll keep is that it's important to also be an inspirational leader. I want to say a huge thank you to the WomenLift Health team for their amazing organization and support throughout this journey. Thank you.